Ethiopia, a land of origins, is renowned as the cradle of ancient civilizations and the birthplace of Arabica coffee. It stands as a symbol of diversity and tolerance, embodying freedom and rich cultural heritage, all while showcasing its unique hospitality. Its varied climates and agroecologies create a suitable environment for agriculture, supporting a vast array of animals and plants. Ethiopia's vast and diverse animal resources, coupled with its favorable agroecological conditions, position the agricultural sector as a vital pillar of the economy.
The agriculture contributes one third of the economy of the country. When we look at the contribution of the livestock to agricultural GDP, it's about 26% directly. And when we consider also the traction and other use from livestock, it can mount up to the 46% of the overall agricultural GDP of the country. Because we have really a large number of population of livestock, and majority, especially in the lowland parts of the community, the livelihood is based on the livestock.
To enhance productivity in the livestock sector, extensive efforts are underway, including innovative agricultural initiatives like Yelamat Tirufat. In this regard, animal health services are crucial.
Attention is paid to the livestock sector of Ethiopia, and thanks to also our Prime Minister, Dr. Abiy Ahmed, to bring this idea to focus on livestock, and through the Yelamat Tirufat initiative. And in that, the Yelamat Tirufat initiative, certain commodities are strategically identified. We aim to increase the production and productivity of dairy, poultry, honey, and fishery. And in that aspect, the role of animal health is really clearly indicated.
For years, Ethiopia has implemented comprehensive veterinary programs to maintain animal well-being and prevent diseases that threaten both livestock and human health. This journey has led to significant extensive experience in delivering a wide range of animal health services.
So in Ethiopia, it is a long time ago that veterinary service is established. Maybe it's around 100 years now when we consider. And there are institutions which were established specifically during the old days due to introduction of some of the diseases which were not in Ethiopia at that time, and specifically rinderpest was the cause for establishment of veterinary service in Ethiopia. There are institutions which established to produce vaccines and veterinary drugs, build the capacity of trained manpower in animal health services to make diagnosis surveillance. So the laboratories were also established a long time ago. We have many universities currently that are also training and producing graduates and specialists from different corners of Ethiopia.
The National Veterinary Institute was established in 1964, mainly for the purpose of combating rinderpest. Rinderpest is, that time it has swept away almost 90% of the African cattle population, and because of that, there was an urge to fight this disease, and NVI was established to produce rinderpest vaccine. And that time, and then after NVI supplied this vaccine.
Animal Health Institute is dedicated to improving animal health in our country through research and diagnosis. In this way, it is doing its part to ensure food and nutrition security, to generate income of farmers and pastoralists by increasing production and productivity, and to protect zoonotic diseases in terms of public health. Controlling and preventing trypanosomiasis caused by the tsetse fly is one of its focus areas.
Ethiopian Agricultural Authority creates enabling environment for delivering qualified and safe veterinary products for animal health sector. We have inspection and control check posts, almost 45 stations across the nation. We have 2 big stations in Bole International Airport and Mojo Dry Port. We are inspecting and controlling the specially vet products in these 2 premises.
We are exporting meats from cattle, sheep and goat and camel to Middle East countries, and we are also exporting live animal to the same countries. And in that case, the quarantine and inspection and certification service is really very mandatory. So under Ministry of Agriculture, we have Ethiopian Agricultural Authority, where such certifications are issued and support the export of livestock products.
Ethiopian Agricultural Authority established by considering to give value addition for our livestock animals, or ensuring the quality, safety, efficacy, health and efficiency of agricultural technology, inputs, products and services.
now የተሟላ እንስሳት በሽታ ምርመራ ላቦራቶሪዎች አሉት ብዙ ላቦራቶሪዎች አሉት
The institute is equipped with advanced laboratories for animal disease diagnosis, including molecular, sequencing, parasitology, and virology labs. We have the only biosafety level -3 diagnostic laboratory in East Africa, focusing on diseases like COVID-19, Ebola, contagious bovine pleuropneumonia brucellosis. The laboratory accredited to ISO 17025 before 10 years, and significantly contributes to the country's animal health and aims to create disease-free zone for better international market access. It serves as a reference laboratory for Newcastle disease and avian influenza in East Africa, and operates as FAO supporting lab for transboundary animal diseases. Since 2025, it acts as a reference laboratory for animal health for COMISA.
The success of animal health and veterinary services relies on collaboration among various stakeholders engaged in disease prevention and control.
The majority of the diseases that are of big concern globally are transboundary animal diseases, which are not restricted to a given country. The international institutions play a crucial role. From veterinary service point of view, we have this World Animal Health Organization, which is really coordinating activities at different continents at the global level, and also we have this continental branch of this organization and also sub-regional branches of this organization. At the same time, there are diseases which affect human being, which are transmissible from human to animals and from animals to human. And in that case, it needs a collaboration between different sectors. That's why now we have the One Health platform. Globally, there is One Health platform, and there is also nationally from Ethiopian side. Also, we have this One Health platform.
NVI contributes in controlling zoonotic diseases. Diseases that transmit from animals to humans. As you all know, about 60 to 70% of diseases are acquired from animals to humans. So NVI plays producing vaccines for these diseases. Currently we produce vaccine for rabies, for anthrax, and in the future we are planning to produce other zoonotic against other zoonotic diseases such as brucellosis. And currently NVI is organized with the human vaccine producing enterprise with the concept of One Health.
Ethiopian Public Health Institute is developing programs to prevent and control 5 key zoonotic diseases: rabies, anthrax, brucellosis, Rift Valley fever, and highly pathogenic avian influenza. During outbreaks of serious zoonotic disease, the National One Health Rapid Response Team has been set up nationwide and sent experts to investigate and coordinate the response. Experts from various One Health sectors are collaborating on control measures, particularly for diseases like rabies and human African trypanosomiasis. The Institute is also implementing mass dog vaccination efforts in collaborating with Ministry of Agriculture.
Veterinary institutions play a vital role in monitoring and controlling animal diseases, producing and distributing vaccines and drugs, as well as providing essential training to health professionals working with local farmers.
NVI is the only or the sole manufacturer of veterinary vaccines for the whole country, and the other is it also started producing drugs. So the impact of NVI for this country is significantly high.
በእንስሳት ጤና ዙሪያ እንደ አገር አንድ ያለን ስለሆነ ስልጠናዎችን በመስጠት
The laboratory provides training for veterinarians, regional laboratory professionals, and technicians regarding animal health to enhance the capacity of stakeholders in the field.
To enhance accessibility, veterinary laboratories have been established across every region, ensuring that farmers can readily access these crucial health services.
We are supporting our regional labs who are doing the diagnosis investigation because they are near to the farmers, near to the pastoralists. They investigate diseases and give response for pastoralists as soon as they can. If it is beyond their capacity, we do have national animal health institutes who are responsible to nationally conduct this diagnosis investigation. We do also have surveillance system. Nationally, we are following Dover and Adenis, which is mobile-based. Adenis is the mobile-based, and Dover is a paper-based from district to regional lab to the ministry as a web-based.
ዋናው የበሽታ ጥናትና ምርምር ነው። ያ ጥናትና ምርምር የሚያደርገው
Regional laboratory focuses on disease surveillance and diagnosis to improve livestock productivity by creating disease-free zones and supports competitive market. During diseases outbreaks, the laboratory monitors reports, collects samples on site, and offers recommendation of vaccines and drugs to technicians. Capacity-building trainings are provided to veterinary technicians in reporting systems, laboratory quality management, and related areas to enhance professional and technological skills.
እንስሳት በሽታ አሰሳ የሚባሉ ስራዎች በስፋት ይሰራሉ።
As a regional laboratory, we are doing a lot of laboratory activities, mainly focuses on disease monitoring and surveillance through two key systems, DOVAR and ADNES. In DOVAR system, monthly animal disease data are collected from communities, compiled and submitted to the laboratory. This information is entered into a web-based system for analysis and filters, prioritizing on transboundary and zoonotic diseases eradication. PPR eradication is being done within this system.
Ultimately, animal health services significantly contribute to both the productivity of the livestock sector and the overall public health.
Generally, we think about the contribution of animal health. It contributed for food safety and security of our community, which are mainly dependent on livestock. Second, livestock trade. If we do have a healthy animal, the importers from our country can be confident to import our product to different countries. The other one is the safety of our community. When we see the community in Ethiopia, they are mostly have contact with the animals. So having healthy animal means having the healthy people. So the animal health also plays important role to secure public health, the surveillance system, the disease prevention control activities, and also the service we are delivering. We need to have a strong veterinary service which contributes for livestock production productivity in general.
The 26th World Animal Health Regional Conference will bring opportunities related to changes in the field of the livestock sector.
I would like to say welcome to Ethiopia, welcome to Addis Ababa to attend the 26th World Animal Health Organization Conference and contribute in terms of knowledge, in terms of giving directions and policy directions, in terms of deciding on critical issues in Ethiopia, in Africa. At the same time, we hope participants from Ethiopia who are directly or indirectly linked or associated with the livestock activities can come and contribute their part. And it's also a good opportunity for us to learn from others.